Hey everyone, today we'll be talking about examination of strength of the muscles. Before examination of the strength of the muscles, so we have to look for presentation of the patients. Patient might be present to you with sensory symptoms or the motor symptoms. Then what are sensory symptoms and the motor symptoms? The sensory symptoms are paresthesia and numbness, okay, and the motor symptoms are weakness and the paralysis. So these are the presentations of sensory and the motor symptoms. Now let us talk furthermore how we can examine power of the muscles. So it can be done with pronator drift test. Okay. So in the figure you can see there is normal pronator drift test and there is positive pronator drift test. Okay. So where we can say it is normal and where we can say it is positive pronator drift. In the figure you can see the patient is extending his arm, forearm and hands. So what happens, they are completely extending. Okay, so there is no any defect, there is no flexion at elbow, hand and wrist, and there is no any asymmetrical in first figure. Okay, but in second figure you can see over here there is asymmetry, so that this is positive pronator drift test. Okay, so in first figure the patient is extending his arm, forearm parallel to ground. Okay, so he must hold his hand for more than 10 seconds. Okay, so this is the criteria for examining the patients. Okay, so now we can see in next presentation. So strength testing for pronator drift is an extremely useful method for screening upper limb weakness. Okay, so positive drift test, so this is positive drift test or normal drift test. These are the important things that we can differentiate either it is limb weakness, upper limb weakness or not. Okay, so the patient is asked to hold both arms fully extended and parallel to ground with eyes closed. I have already explained about that things. Okay, this position should be maintained for more than 10 seconds. Any flexion at elbow or fingers or pronation of the forearm, especially if asymmetric, is a sign of potential weakness. Muscle strength is further assessed by having the patient exert maximal effort for particular muscles. Okay, or muscle group. It is important to isolate muscle as much as possible. Okay, so we can define that by hold the limb so that only muscle of the interest are active. Okay, so it is also helpful to palpate accessible muscle as they contract. So with this test we can look for weakness. Okay, so now we are talking about pronator drift test, and this is the method for doing pronator drift test. Okay, if there is weakness, if there is anything, then how we can grade that test. Okay, now you can see furthermore the muscle strength is traditionally graded using the following scales. Okay, so 0 if there is no movement, that is 0. If there is flicker or press of contraction but no associated movement at the joint, we have to look movement at the joint. So there is no flicker. If there is flicker, okay, or press of contraction but no associated movement at the joint, then we can grade that with 1. What is 2? 2 is movement with gravity eliminated. 3 is movement against gravity but not against resistance. Okay, so 4 we can see three things: 4 minus, 4 and 4 plus. Okay, so 4 minus means movement against a mild degree of resistance, that is 4 minus. Okay, and 4 means movement against moderate resistance. 4 plus means movement against strong resistance. Okay, and 5 means full power. So this is the muscle strength grading. Okay, so if there is 0, there is no movement. If there is flickering movement, that is 1. If 2 is movement with gravity eliminated, 3 means movement against gravity but not against resistance, 4 minus, 4 and 4 plus. 4 minus means movement against a mild degree of resistance, 4 means movement against moderate resistance, 4 plus means movement against strong resistance, and 5 means normal, that is full power. Okay, so in this way we can grade. So what is the importance of these things? Now we have to, after examining the patient, now we have to simplify it. We have to define the terms. So if there is no movement, then we can define paralysis. Okay, Severe weakness means movement with gravity eliminated. Moderate weakness means movement against gravity but not against mild resistance. Mild weakness means movement against moderate resistance, and if the grade is 5, then we can say this is full strength. Okay, now why there is what why we have to look for the weakness. Okay, so weakness say something is going in our body. Okay, so if there is unilateral or bilateral weakness of the upper limb, extensor or lower limb flexor suggest a lesion of the pyramidal tract. So there is unilateral or bilateral weakness of the upper limb extensor and lower limb flexor. There is pyramidal tract lesion, which means pyramidal weakness. Okay, bilateral proximal weakness suggests myopathy. Okay, so if there is bilateral proximal weakness, then it can suggest myopathy. If there is bilateral distal weakness, suggest peripheral neuropathy. Okay, so with this we can locate different things on the basis of weakness. We can identify stroke, you can identify different neurological symptoms. Okay, so this is one of the most important topic. With this I have completed my presentation here. If there is any query, we can discuss with the comment section. Have a nice day. Thank you.